Birth choices refers to the various options available to a pregnant person regarding how, where, and with whom they give birth. These choices can significantly affect the birth experience and outcomes. Here's a breakdown of the main birth choices. 1. Location of birth hospital. Birth. Most common, access to medical staff and emergency interventions. Birth center. More home-like setting, typically midwife-led, and focuses on natural birth. Home birth. Chosen for comfort and control, usually assisted by a midwife. Best for low-risk pregnancies. 2. Type of birth attendant, obstetrician-gynecologist, OB/GYN. Medical doctor. Can perform surgeries like C-sections. Midwife specializes in low-risk pregnancies. Promotes natural birth. Doula, non-medical support person, provides emotional and physical support before, during, and after birth. 3. Pain management options. Epidural. Most common in hospitals, numbs lower body. IV or IM medications. Systemic pain relief, but can affect baby. Natural methods, breathing techniques, water immersion, massage, hypnosis, movement, etc. 4. Type of birth, vaginal birth. Most common and often fastest recovery. Cesarean section, C-section, surgical birth, planned or emergency. VBAC, vaginal birth after cesarean. Attempting vaginal delivery after a previous C-section. Assisted birth use of forceps or vacuum extraction. 5. Birth plan preferences. Positions for labor and delivery, squatting, lying down, etc. Immediate skin-to-skin contact. Delayed cord clamping. Use of fetal monitoring, who is present during labor. Newborn procedures, e.g., bathing, vitamin K shot, eye ointment. When it comes to welcoming a new life into the world, one of the most significant decisions expectant mothers and their healthcare providers face is the choice between vaginal birth and cesarean section, commonly known as a C-section. Each method comes with its own set of advantages and challenges, both medically and personally. Understanding the pros and cons of each can help parents make informed decisions that are best suited to their unique circumstances and preferences. Vaginal birth is the natural process by which a baby is delivered through the birth canal. For centuries, this has been the standard method of childbirth. One of the most notable benefits of vaginal birth is the typically shorter recovery period. After a vaginal delivery, many women are able to move around and care for their newborns more quickly. The risk of major surgery is avoided, reducing potential complications such as infections or blood clots that can sometimes arise after an operation. Another advantage of vaginal birth is the role it plays in the baby's transition to life outside the womb. As the baby passes through the birth canal, the pressure helps to expel fluid from the newborn's lungs, which can reduce the likelihood of respiratory issues after birth. Additionally, exposure to beneficial bacteria in the birth canal may help establish the baby's immune system, potentially leading to a lower risk of certain allergies and diseases later in life. For many mothers, the experience of vaginal birth can also be emotionally empowering. The ability to actively participate in the birth process, coupled with the surge of hormones like oxytocin, can foster a strong bond between mother and child right from the start. Immediate skin-to-skin contact and early initiation of breastfeeding are often easier to achieve after a vaginal birth, further supporting the mother-baby connection. However, vaginal birth is not without its drawbacks. Labor can be unpredictable, sometimes lasting many hours or even days, and the pain associated with contractions and delivery can be intense. Though pain relief options are available, such as epidurals, not every birth goes according to plan. Some women may require interventions such as forceps, vacuum extraction, or even an emergency C-section if complications arise. Vaginal deliveries can also result in physical challenges, such as tears or episiotomies, which may require stitches and lead to discomfort during recovery. In some cases, women may experience pelvic floor issues, including incontinence or prolapse, particularly after multiple births or deliveries involving large babies. On the other hand, a C-section is a surgical procedure in which the baby is delivered through incisions made in the mother's abdomen and uterus. This method is often recommended when vaginal delivery poses risks to the mother or baby, such as in cases of placenta previa, breech presentation, multiple births, or fetal distress. In some situations, mothers may choose a planned C-section for personal or medical reasons. One of the primary benefits of a C-section is the ability to schedule the birth, providing a sense of predictability and control for parents. For certain high-risk pregnancies, a C-section can be a life-saving intervention, reducing the risk of complications that might arise during a prolonged or difficult labor. The procedure itself is typically quick, with most deliveries completed within an hour. Mothers may avoid some of the physical trauma associated with vaginal birth, such as severe tearing or pelvic floor damage. In cases where the baby is in distress, a C-section can be performed rapidly to ensure the safety of both mother and child. Despite these advantages, C-sections are major surgeries and come with inherent risks. Recovery after a C-section is usually longer and more painful than after a vaginal birth. Mothers may spend several days in the hospital and need assistance with daily activities during the initial weeks of recovery. There is a higher risk of surgical complications, including infections, blood clots, and increased blood loss. The effects of a C-section can also extend into future pregnancies. Women who have had a cesarean may face a higher risk of certain complications, such as placenta accreta or uterine rupture, especially if they attempt a vaginal birth after cesarean VBAC. Additionally, multiple C-sections can increase the likelihood of adhesions, which are bands of scar tissue that can cause pain or interfere with other organs. For the baby, C-sections may be associated with a slightly higher risk of breathing difficulties at birth, particularly if the procedure is performed before labor begins. Some research suggests that babies born via C-section have a different composition of gut bacteria compared to those delivered vaginally, though the long-term implications of this are still being studied. Beyond the physical considerations, the emotional and psychological aspects of childbirth play a significant role in shaping a woman's experience. Some mothers may feel a sense of disappointment if they are unable to have a vaginal birth, especially if their birth plan changes unexpectedly. It's important to recognize that every birth is unique, and the well-being of both mother and baby is the ultimate priority. Both vaginal birth and C-section have their place in modern obstetrics, and the best choice will vary depending on individual health, pregnancy complications, and personal preferences. Open communication with healthcare providers is key to understanding the risks and benefits of each option, and to making a decision that aligns with one's values and circumstances. In summary, vaginal birth offers benefits such as a quicker recovery, lower risk of surgical complications, and physiological advantages for the baby. However, it can involve unpredictable labor and potential for physical trauma. C-sections provide a controlled environment and can be essential in high-risk situations, but they require longer recovery and carry surgical risks. Ultimately, the choice between vaginal birth and C-section is highly personal, and what matters most is a healthy outcome for both mother and child. With the support of knowledgeable healthcare professionals, parents can navigate these options confidently, prepared to welcome their new baby in the way that's right for them.